Okay, to start our intro and extra oral exam today, I'll first be verbalizing the PPE I'll be wearing. I'll be wearing mask, loops, face shield, cap, gown, and gloves, and I've sanitized my hands. I'll start by observing the head and neck area. Well, first starts out with my patient, what we're doing today. Hello, Bruce. Today we'll be doing your intro and extra oral exam. What the purpose of this exam is a pre-cancer screening, as head, neck, and oral cancers are a very common form of cancer. May I proceed? And he'll say yes, and then I'll look all through the head and neck area, and I'll grab my probe and I'll walk around to the back and look at the back of his neck as well. And I do notice localized to the helix of the right ear a regular border brown 3x3 macule, and I know this is duration lifetime. I also noticed localized inferior to the right eye a regular border brown 2x2 macule, duration lifetime. Then I'll move on to the TMJ, and I'll place my hands my fingers where they'll sink into the TMJ area. And I'll have my patient open and close 3 times slowly. And I do notice popping on the right side, and I'll note that down. Then I'll start by palpating the post and preauricular lymph nodes with bilateral circular palpation technique. And I'll walk around to the back and do the same palpation technique for the occipital lymph nodes. These all feel within normal limits. And I'll go with the same palpation, bilateral bimanual circular palpation technique on submandibular lymph nodes, and I can have my patient stick his tongue to the roof of his mouth. Then move on to submantle lymph nodes. Then using bilateral bimanual palpation circular technique on the cervical lymph nodes. I have my patient turn to his left to feel for superficial and deep, right, superficial and deep, and these all feel within normal limits. Then I'll ask my patient for consent again. Hello, Bruce, I need to palpate around your clavicle area. May I proceed? And he'll say yes. And then I will palpate bilaterally in the thyroid area. And then I'll ask my patient to swallow, and I'll observe and feel with a manual palpation technique. And that feels within normal limits. And now I'll remove my gloves and sanitize my hands. Then I'll observe the lips. I'll spread the lips a bit on the vermilion borders. And I do notice generalized to both upper and lower lips vortices spots and pigmentation. And now I'll observe the labial mucosa. And I have a mirror here. And then I'll bidigitally palpate the lips. And that all feels within normal limits. Now observe the buccal mucosa and observe the parotid papulas at the same time. And I do notice bilateral linea alba, and then I'll bidigitally palpate. And then I'll get my cotton tip and express both parotid papulas for normal salivary response. I can't really see it here, I need more light, but I would do that. And look at my, observe the salivary response and look at my cotton tip applicator, make sure it's saturated. Then I would move on to observing the hard palate and soft palate. And here sometimes I just observe the retromolar pads at the same, the maxillary tuberosities at the same time. Okay, they all look within normal limits. And then I'll digitally palpate and I'll tell Bruce, hey, this might tickle a little. And those all feel within normal limits. And then I'll observe the oral pharynx, have my patient stick out his tongue and say, ah, ah. And the oral pharynx looks within normal limits. Then I'll observe the tongue, I'll observe the dorsal surface, I'll have my patient stick out their tongue. And then stick the tongue to the roof of the mouth to observe the ventral surface. And then I'll grab my gauze to observe the lateral borders of the tongue. Those all look within normal limits. Then I'll bidigitally palpate the tongue. And I'll observe the floor of the mouth. And I do notice a bilateral mandibular toroid, just lingual to tooth number 21 and 28. And then I will palpate with bimanual palpation. And I'll observe the alveolar ridges. And as I observe the alveolar ridges, I also observe the retromolar pads, and I'll use bidigital and digital palpation. And then I'll tell Bruce, okay, now we've completed the head and neck exam portion of our care today. Thank you very much.